Good evening. My name is Patrick. I'm a student from Hastings University for class NU 673, Psychiatric Mental Health Care Provider 1. I have a substance use presentation, and the substance of choice that I presented for this PowerPoint is marijuana, cannabis, and this is a disorder that has affected both young and old, and due to increased usage and it is addictive in nature, I decided to do a presentation of this. Marijuana is used in the form of dried leaves, flowers, stems, and seeds. And due to this increase of usage, clinicians need to be aware of its impact in the society involving young people and adults. Regarding the history of marijuana use, it dates back to 1800, and currently the public approach towards marijuana is kind of acceptable, that it is harmless. Worldwide, it is illegal, but to some countries, especially North America, some states have legalized its use, although still it is limited to some extent. In Canada, 45% of people aged above 15 years old have tried using marijuana, and 34% of those who use marijuana have used it once, and actually 3%, as by reports, indicates that they use it weekly or more frequently. The preference and epidemiology of marijuana in US is that in 2021, 35.4% of young people aged 18 and above were 11.8 million. And it was reported that in 2022, 30.7% of 12th graders reported using marijuana in previous year. And out of that, 6.3 reported using daily. And so these statistics indicates that is both affecting the young and also the older. Regarding the usage, many believe that use of marijuana is harmless, and its usage has increased for both young and old. The fastest growing health issue in the US by 2030 is estimated that older people is projected to exceed 72.1 million. And so this is a concern for both young and old people, that it is acceptance as harmless, and increase in statistics. It indicates that are gonna be a slippery slope and a major concern due to abuse. Let's see some of the risk factors and vulnerable population that are affected by marijuana use. Risk factors include sexual abuse, family history of using marijuana, antisocial behavior, impulsivity, anxiety, and mood disorders. Other risk factors include a stressful life event, being male, low socioeconomic status, those who associate with drug users, mental and medical illness, lack of emotional or family support, low education, poor academic performance, and familial risk factors such as negligence and poor supervision. Some of the short and long-term side effects include change in mood, compromised body movement, alters sense of sight and also time, compromised memory, such as memory loss, delusional thinking, especially when consumed in large quantities, and also psychosis when used regularly and in large quantities. Other short-term and side effects include insomnia, decreased appetite, anxiety, cravings, and disability with mental decline or verbal, a general knowledge and verbal inability, or things such as impaired thinking, memory loss, and this is due to effects of the brain development. Some of the signs and symptoms of abuse, and these are some of the signs that nurse practitioner recognize when doing assessment. These include uh, patients who keep using marijuana even when they have tried to quit but they are unable to quit, spending much time using marijuana, experiencing cravings, and having problems such as inability to perform work or school, but still this patient keeps on using. The continued use of marijuana, regardless of social or family problems or relationship, and also giving up important activities or friends in favor of marijuana. It also involves having risk activities or taking risks such as driving while using marijuana or influenced by marijuana. Other signs and symptoms that uh, indicate that someone has a problem with marijuana is withdrawal symptoms. Even after stopping, still these patients experience withdrawal, and also needing the need to use more marijuana to have a high effect. Potential overdose or suicidal weapon of choice. This includes using marijuana with the tendency or behavior in general population compared to the general population. Those people who use marijuana have high suicidal behavior, or as by Nichelle, the article, those who use marijuana are twice likely to commit suicide. And there's increased risk of suicidal behavior, ideation, and attempt, as well as completed suicide. Let's see the care plan for patients that are taking marijuana. First of all, uh, care providers such as a psychiatric nurse practitioner, they uh, perform comprehensive assessment. And regarding pharmacological treatment, there is no approved uh, food and drug administration, food and drug administration that approved medication, but providers use off-label medication to treat cravings, withdrawal symptoms, and other psychiatric disorder that are associated with marijuana. A dose of 25 milligram to 50 milligram of naltrexone can help with cravings and also help prevent impulsive behavior. Serotonin and norepinephrine reuptake inhibitors, drugs such as hydroxyzine, alpha 2 agonists, and gabapentin can be helpful for patients who try to stop using marijuana. Also, medication that have sedating or mood stabilizer effects and also antidepressants are really helpful, like uh, Seroquel and mirtazapine. Regarding non-pharmacological treatment, this involves cognitive behavioral therapy, which help to teach patients on strategies to identify and correct behavioral issues. They also help with the self-control on how to stop using marijuana, as well as on how to deal with harm-related issues or the side effects of marijuana. Another non-pharmacological treatment is motivational enhancement therapy, which help to produce some change and using internal resources for change. Regarding patient education, providing education is really important, and this involves educating the patient signs and symptoms of marijuana adverse effects, increased heart rate, insomnia, dizziness, decreased blood pressure, paranoia, anxiety, and impaired attention, as well as memory loss. For patients, for providers who give care, they need to provide a care without judgment, especially for those who use marijuana for managing pain or other disorders. Regarding referral, there are providers who manage pain and they are involved in prescribing this marijuana. Those kind of patients who need this treatment may be referred to these providers. Regarding follow-up appointments, patients using marijuana may at one point require a psychiatric assessment for risk assessment and also assessment for harm reduction strategies as well as monitoring medication and behavior. In conclusion, marijuana is one of the substances that has been greatly abused, and due to it is due to the fact that many states are now regularizing marijuana, is likely to be abused for young people and older people as well. The rate of young and geriatric marijuana use has increased, and this is due to a belief that marijuana is harmless. And so due to increase of this usage and the government's role to regularize marijuana, providers need to be aware that it is effect, and also it should be bear in mind that it's important to do assessment. Marijuana usage, and it is important for providers to update their knowledge on providing effective care and therefore providing assessment and effective care is really important. And the last two, the references that I used is PowerPoint. Thank you all.